Discover natural solutions for constipation, the benefits of magnesium, and the surprising impact of exercise on your gut microbiome. Get ready to transform your health journey. Your microbiome is not fixed. You can shape and change it through your choices, impacting it as soon as tomorrow. Consistent small changes can lead to permanent results. Dr. Bulsiewicz discusses gut health, microbiome, and the benefits of a fiber-fueled lifestyle. His expertise in gastroenterology emphasizes the how-to aspects of optimal eating and its impact on cognition, brain health, and more. Cancer tumors have their own microbiome, and the diversity within it is linked to prognosis. Higher diversity in both gut and tumor microbiomes correlates with better survival rates, as observed in studies on acute myeloid leukemia and melanoma patients. Increased dietary fiber intake, even below recommended levels, is associated with improved survival in melanoma patients undergoing immunotherapy. For every 5 grams of increased fiber consumption, there's a 30% higher chance of survival. Exploring the potential of manipulating the microbiome for cancer treatment, including topical or injectable microbial solutions to enhance treatment effectiveness. The discovery of the tumor microbiome has the potential to revolutionize cancer care. The microbiome, once undervalued, is now a vital source of information about human health, with transformative implications for fields like cancer care. The study of microbiome is akin to discovering a new dimension in our understanding of life. The microbiome, though invisible, has personalities, groups, and dietary needs similar to humans. It's a complex system comparable to the organization of the universe. Thinking about human health in a holistic way is crucial, considering the interconnectedness of variables. While scientific progress often involves studying isolated factors, it's essential to understand their function in a more complex system. The microbiome's impact on the immune system is significant. Maintaining a diverse microbiome, particularly through fiber-rich diets, is crucial for overall health, including the ability to combat diseases like COVID-19. Fiber plays a key role in protecting against respiratory viruses. High-fiber diets promote the release of short-chain fatty acids, which, when reaching the lungs, manipulate the immune system to resist respiratory infections. Severe COVID-19 is associated with a loss of specific bacteria producing short-chain fatty acids. A plant-based diet with high fiber intake is linked to a reduced likelihood of moderate to severe COVID-19. Low-carb diets are associated with a higher likelihood of developing moderate to severe COVID-19. Plant-based diets, rich in fiber, show better outcomes. Stress, lack of outdoor time, and lifestyle changes during the pandemic may have negatively impacted microbiome diversity, affecting overall health. Long COVID is associated with a disturbance in the gut microbiome, similar to patterns observed in severe COVID-19 cases. Future studies may reveal the protective role of fiber against long COVID. Gut microbiome disturbance linked to metabolic risk factors like obesity, high blood pressure, and type 2 diabetes. Microbiome not just about gut health but crucial for metabolic health, influencing resistance to chronic ailments and inflammation. Microbiome is a community of invisible microorganisms covering external surfaces, with a concentration in the intestines, colon. Human microbe coevolution, microbes essential for digestion, metabolism, hormones, immune system, brain health, cognition, and genetic expression. Human genetic code viewed as switches, microbes at the switchboard, influencing health conditions based on gene expression. Future in personalized nutrition using microbiome data to predict individual responses to dietary interventions, leveraging supercomputers for complex algorithms. Zoe's approach, citizen science project with microbiome testing, standardized meals, continuous glucose monitoring, and blood lipid testing for personalized nutrition insights. Consumer participation in Zoe involves submitting a stool specimen, wearing a continuous glucose monitor, entering food data into an app, and contributing to scientific research. Zoe's data collection and scientific validation precede the consumer product release, demonstrating integrity and ensuring efficacy before offering to the public. The microbiome plays a powerful role in weight balance, with changes in the gut microbiome observed in overweight or obese individuals. Fiber intake influences satiety hormones, and a diet lacking fiber can lead to overeating and weight imbalance. Fiber content, not just calories or macronutrients, affects fullness, as demonstrated by a study comparing tofu-based and pork and cheese-based burgers. The microbiome is linked to metabolic health, with specific microbes associated with healthy and unhealthy metabolism. Probiotics face challenges, and the complexity of the microbiome requires a personalized approach for lasting changes. Long-term healthy changes in the microbiome require sustained habits and small daily changes, not quick fixes. The gut-brain connection involves communication through the vagus nerve, neurotransmitters, and signaling molecules, influencing mood, cognition, and memory. The gut microbiome influences various aspects of human life, including cravings, mood, and memory. Studies suggest that cravings can shift based on the gut microbiome, influenced by fecal transplants, even in humans. Cravings for certain foods may be driven by the microbial ecology in the gut, signaling the brain to fulfill specific dietary needs. Shifting to a healthier diet may change the gut microbiome, leading to cravings for nutritious foods instead of unhealthy ones. Changing diet can transform taste buds over time, influencing food preferences and reducing cravings for unhealthy options. Dietary interventions, particularly increasing fiber intake, have shown improvements in mood disorders like depression. People with mood disorders, such as anxiety and depression, show specific microbial patterns with reduced diversity and more inflammatory microbes. Depression is described as an inflammatory disorder, and dietary interventions aim to combat inflammation through microbiome changes. Circadian rhythm influences insulin sensitivity, peaking in the morning, and gut microbes play a role in this daily cycle. 3 types of prebiotics: fiber, resistant starches, polyphenols that feed gut microbes are found in plants, emphasizing the importance of a plant-based diet. A diverse diet with various types of fiber and polyphenols from different plants promotes diversity in the gut microbiome, crucial for overall gut health. The diversity of plants in the diet is a powerful predictor of a healthy gut microbiome, according to the American Gut Project, with those consuming 30 or more different plants per week having the healthiest guts. Make diversity in plant consumption a central dietary philosophy. Focus on the number of plant varieties in your diet instead of counting grams of fiber, macros, or calories. Introduce the plant points game to make it fun, especially for kids. Introducing fermented foods into the diet, as studied by Justin Sonnenberg and Christopher Gardner, can increase gut microbiome diversity and reduce inflammation. Emphasizes the importance of a more traditional-based diet with fermented foods. While the carnivore diet may show short-term improvements, it lacks long-term studies in fiber, essential for gut health. Advocates for predominantly plant-based diets and highlights the dangers of an American diet high in ultra-processed foods and low in plants. Focus on fiber intake for optimal health, as many people are fiber deficient. Expresses concern about the rise of the carnivore diet, emphasizing that diverse plant-based diets have strong scientific backing for overall health. Caution against attributing gut healing to the carnivore diet, stating that discomfort absence doesn't equate to true healing. Warns about the negative impact of saturated fat on the gut microbiome and its role in insulin resistance. The carnivore diet's high saturated fat can drive up LDL cholesterol, a risk factor for coronary artery disease. Caution is advised. Advocates of carnivore diets downplaying elevated LDL cholesterol risk may be causing harm. Caution against being a guinea pig without sufficient data. Embrace a growth mindset in approaching dietary changes. Aim for progress over perfection in adopting a plant-predominant diet. Distinguish between food allergies and intolerances. Allergies involve immune system activation, while intolerances manifest with symptoms but don't activate the immune system. Commercially available tests for food intolerances against antibodies, etc., lack reliability. Recommend a stepwise approach: genesis, restrict, observe, work it back in, train your gut. Growth strategy for addressing food intolerances involves identifying root causes: constipation, celiac disease, gallbladder dysfunction, followed by a stepwise approach: row, restrict, observe, work it back in, and training the gut for adaptability. Histamine is a signaling molecule present in our bodies, but excessive consumption through food can overwhelm our ability to handle it, leading to symptoms like gas and bloating. Histamine intolerance symptoms can include hives, flushing, runny nose, headache, and rapid heart rate. Gas and bloating are common and can be alleviated with a low histamine diet for 2 weeks. High histamine foods include fermented foods, vinegar, chocolate, alcohol, and certain animal products. Plant foods like spinach, tomatoes, eggplant, and avocados can also contribute to histamine. Histamine intolerance diagnosis involves a 2-week low histamine diet. Dr. Bulsiewicz's book provides a protocol with 25 recipes to help identify and address histamine intolerance. People with histamine intolerance often have a damaged gut, and resolving dysbiosis with non-histamine plant foods is crucial. A systematic process is needed to reintroduce foods after the initial low histamine diet. Many people are unaware of histamine intolerance, and symptoms like gas and bloating may indicate the need for a low histamine protocol to identify and address the issue. Bowel movements reflect the health of the gut microbiome. Complete evacuation is crucial, and constipation, indicated by gas and bloating, is a common issue. The stool is primarily composed of gut microbes. Overflow diarrhea can occur in chronic constipation cases, where impacted stool leads to liquid passing through. Flushing it out becomes a paradoxical solution for relief. Frequent bowel movements, as in the case of a high-fiber diet and running, are normal. Motility stimulation from movement contributes to both frequency and form of bowel movements. Fiber may not always resolve constipation, and a cautionary note is shared about the potential for worsening gas and bloating due to fermentation and methane gas production. Dr. Bulsiewicz discusses constipation and its connection to food intolerances, emphasizing the importance of addressing the root cause. Magnesium is suggested as a natural remedy for constipation, with specific forms like magnesium oxide, citrate, and sulfate recommended. Starting with 500 mg before bedtime is advised, with adjustments based on individual response. Collaborating with a healthcare provider, monitoring magnesium levels during supplementation is crucial to avoid excess, ensuring it addresses a deficiency. Magnesium's chemical composition aids in pushing waste through the colon, introducing additional water to facilitate bowel movements. Besides dietary changes, enhancing gut health involves practical actions such as exercise, sleep, social connections, and even holistic healing to address trauma. Exercise, even in a 15-minute minimum dose, can positively impact the gut microbiome by increasing butyrate-producing microbes. Quality sleep contributes to gut microbial diversity, while connecting with others and relationships also influence the microbiome. Studies show that spouses share more microbes based on emotional connection rather than diet, highlighting the impact of love and affinity on the gut microbiome. Holistic healing, considering emotional and psychological aspects, is crucial for patients with unresolved health issues, as trauma can affect the gut microbiome. For the full podcast, check out the link in the description.